We're joined today by Dr. Joel Scholten, and Joel is a rehabilitation physician with the VA. Joel, tell us a little bit about yourself.
Well, good morning. So I am a rehabilitation physician or a physiatrist with the VA, and I have a rather unique position in VA. I work both as the National Director for Physical Medicine and Rehabilitation for VHA, as well as serve as the Associate Chief of Staff for Rehabilitation Medicine at the Washington, D.C. VA. So I get to not only work on policy for our system of care, but I get to implement that policy and still care for veterans with TBI. So it's a great privilege of mine.
That's fantastic. And how long have you been with the VA?
I've been with the VA for over 18 years. I started at the Tampa VA at the before it was a polytrauma center. Tampa was one of the lead traumatic brain injury rehab centers for the VA. And then as the wars started and the complexity of injuries of service members returning from the Gulf required more comprehensive rehabilitation, they were renamed polytrauma centers. And so I was the director of the TBI CARF rehabilitation programs at the Tampa VA for 10 years. And had some amazing clinical experiences during that time, as you can imagine, and then took a job in D.C. To kind of work a little more on policy and the healthcare system. So it's really been an amazing journey for me in the VA.
Great. You touched on sort of the structure of the VA and the polytrauma system. Could you go into that a little bit more?
Oh, absolutely. So the VA has probably the world's largest integrated traumatic brain injury system of care. So we have over 110 teams across the United States and Puerto Rico, ranging from 5 of our most complex and most comprehensive centers. They're polytrauma rehab centers providing inpatient acute rehabilitation. And we have polytrauma network sites that are designated in each of the VA's VISNs or regional areas. And they serve as a regional resource for education, referrals, care coordination for throughout the VA, practicing predominantly outpatient TBI rehabilitation, and then over 80 polytrauma support clinic teams that are teams designated at most of our VA facilities, providing comprehensive evaluation and treatment for TBI. Every VA that does not have a fully integrated team has at least a point of contact that helps to connect veterans with TBI to the closest team and get them the necessary services that they need.
That's great. It's so important that the VA have an integrated system, and we know TBI is pretty prevalent among our service members and veterans. Could you give us a sense of just how prevalent TBI is?
Certainly. So we actually have been screening every returning service member or every new veteran entering VHA for healthcare for possible TBI. So every veteran that's separated from service after September 11th of 2001 is asked a 4-question TBI screen. And if they answer yes to those 4 questions, they're referred for a comprehensive TBI evaluation for a definitive diagnosis as well as an appropriate treatment plan. About 20% of all veterans screened for possible TBI have a positive screen. And those that come for the evaluation, about half will be diagnosed with TBI. So in grand total, it's about 9% to 10% of all OEF, OIF, OND veterans using VHA for healthcare have a history of TBI.
Okay, and we're talking TBI of any severity for that large percentage of veterans.
Correct. And so much like the general population, mild TBI is much more common than moderate and severe. So the vast majority have sustained a mild TBI in the past.
So we've talked about the integrated VA polytrauma system. Could you talk us a little bit more about what the integrated care and interdisciplinary teams look like?
Oh, absolutely. So those individuals that come in for a comprehensive evaluation, as I mentioned before, receive a diagnosis. So either yes or no, did they sustain a TBI in the past? And then what are their ongoing symptoms and what what is the individualized treatment approach that each of those veterans needs. And so the teams are somewhat variable across the system, but most teams have a rehabilitation physician, a psychologist, a case manager, physical, occupational, and speech therapy. Some of the larger centers have a more expansive team that might include vocational rehabilitation specialists, blind rehab specialists. As the injuries get more complex and more organ systems are involved, the team gets larger to meet those individual needs. So that is highly individualized based on the veteran's needs. But the real hallmark of TBI rehabilitation, and this again is for TBI of any severity, is that an individualized plan of care is developed, and we build the team around the patient or the veteran. And it's very important to include the veteran in that decision-making process as part of that team, as well as their caregivers and their family support system, because that's really what's going to help us particularly in an outpatient setting, make sure that some of the recommendations that we're providing are actually followed up on. We want to engage the veteran and engage their caregivers or their family support system.
Mm-hmm. And that's so important to have the patient at the center of this model and really driving all the treatment decisions and around them.
Absolutely. I think we've in rehabilitation, we've always thought we're pretty veteran centric, but I think we can always continue to strive to be better at that. Sometimes we are still very provider centric in the fact that our clinics tend to run just between 8 in the morning and 4:30 in the afternoon. So we're looking at ways to engage with veterans and support veterans that are still living and working in their communities. So we don't want them to have to take lots of time off from work just to attend appointments. We don't want them to be professional patients. We want them to be independent and engaged in their communities. So we need to look at how we can best support that through innovative technology, having more flexible clinic hours. And we've done a lot of work in the area of telehealth and virtual care as a way to engage with veterans even in their home setting, or such as using clinical video telehealth to the home to do some of the follow-up appointments. So that's a really exciting area, and we're continuing to push for that greater integration of that care throughout VHA.
Great. And back to the interdisciplinary team, you mentioned there are some psychosocial and mental health supports involved as well. Could you touch on that angle a little bit?
Sure. So a lot of our teams actually have psychologists that are embedded on the team, and that really is, as far as I'm concerned, a best practice. As I mentioned before, about 10% of the OEF, OIF, OND veteran population has a TBI diagnosis. When you look further at that cohort, 75% will also have a PTSD diagnosis. 50% will have PTSD and a pain condition with that. So this is a very complex patient cohort. They've got lots of comorbid conditions that really complicate their treatment picture and treatment planning. And as you can imagine, those additional issues can provide an additional burden and the need for mental health engagement. And really one thing to acknowledge is the fact that effective mental health interventions can be very challenging for veterans to actually complete. We know it's much easier to take a pill than it is to come in for 12 psychotherapy sessions to deliver evidence-based treatment for PTSD. So again, going back to the veteran and the caregiver as part of the team, it's really have to work on getting that buy-in and that engagement to really promote the use of evidence-based medicine in this patient population.
Excellent. And, certainly they've earned that care and deserve the best treatment possible. So speaking of engagement, I understand you're also involved with employee engagement, and you're pretty active on social media as well. His Twitter handle is @VATBIDoc, so you can certainly find Joel on Twitter, but tell us a little bit about that.
Well, certainly I started in Twitter a little bit begrudgingly. Our hospital had asked all service chiefs to open a Twitter account, but I found it very early on that it was a way that I could acknowledge some of the great work that my employees were doing. So if there was a patient compliment about a particular therapist, I would write that up, take a picture of the therapist, and tweet that. And then I was getting a lot of feedback and follow-up from not only the medical center, but from other veterans that were reporting that they had a great experience with that particular therapist. I would then share that with our employees. They really appreciated being recognized, and it was a nice way of engagement, at least that was, I felt, under my control and something that I could do, and it ended up being very fun. As I continued to, tweet away, I have engaged or connected with other rehabilitation professionals across the country, and certainly other great VA program offices. And it's really nice to kind of promote some of the positive things that VA is doing and some of the great programs that we have. And so that's, I guess, been my way of engaging not only with employees, but with other rehab professionals, and trying to get the word out that, VA has a lot to offer. There certainly are negative stories about VA out there, but I think it's also in our sphere of influence that we can promote some of the great things we do, and some of the great, particularly for me, some of the great rehabilitation programs that we have.
Yeah, again, that's so great to hear. Then just utilizing the power of social media to really share the good things happening inside the VA, both with employees, new programs, and everything going on. So it's really been a great experience. I know you have a plane to catch. I don't want to take too much of your time. Any final thoughts for today?
Well, I will just say that I know you're with the MyRec out in Denver, and you guys do terrific work. And, if only all veterans were as excited about VHA healthcare as our Cubs fans are here in Chicago. But you do terrific work, and particularly on suicide awareness and suicide prevention. And I would just go back to the fact that interdisciplinary care for TBI and rehabilitation is really essential. And it's also essential that every team member realize that it's part of their job to also include some aspect of suicide assessment or suicide awareness, because we really owe it to our veterans that we have the privilege to serve, that this is really rehab is a team sport. Suicide awareness and suicide prevention is also a team sport. So we need to continue to encourage that awareness, because it's just so critically important.
Very well said. Well, everybody, thanks for joining us for today's session. You can learn more about Dr. Scholten and his work by clicking on the links accompanying the podcast, and be sure to reach out to us if you have any questions or comments about what we discussed today. Until next time, this has been the Rocky Mountain MyRec Short Takes on Suicide Prevention podcast.